Thank you for joining us for this Million Hertz Learning Lab pre-work for the session titled "A Statin is Indicated for Your Patient, Getting There Together." You are about to hear from Dr. Angela Thompson-Paul, Senior Epidemiologist with the Division for Heart Disease and Stroke Prevention at the CDC and lead author on the recent publication, Recommended and Observed Statin Use Among U.S. Adults, National Health and Nutrition Examination Survey 2011 to 2018. Dr. Thompson-Paul?
Thank you. For this Million Hearts Learning Lab pre-work, I will briefly review the current cholesterol management guideline and describe the data on statin use at the national level. Next slide, please. The 2018 cholesterol guideline specifies indications for screening and treatment with lipid-lowering statins. In all individuals, a heart-healthy lifestyle is indicated to reduce the risk of atherosclerotic cardiovascular disease, or ASCVD. It is also important to screen for dyslipidemia, and this screening can now be performed with non-fasting lipid panel. Additionally, the 2018 guideline identifies 4 patient groups at the highest risk for ASCVD events that could benefit from statin therapy. These groups include patients with history of clinical ASCVD, patients with severe hypercholesterolemia, LDL cholesterol greater than or equal to 190 milligrams per deciliter, patients aged 40 to 75 years with diabetes mellitus, or patients aged 40 to 75 without diabetes and with a 10-year ASCVD risk of at least 20%. Next slide, please. This figure shows cholesterol-lowering recommendations and statin use among U.S. adults using data from NHANES 2011 to 2018. Using the 2018 cholesterol guideline, 135 million adults were classified as being in the non-pharmacological group who were not recommended or considered for statin treatment. 50 million adults were classified as considered for a statin. This group has an intermediate ASCVD risk, and while statin therapy was recommended, it could be favored after additional consideration of risk-enhancing factors. An additional 46 million adults were classified as being at high risk for ASCVD events and recommended for statin therapy. This presentation will further focus on opportunities for the statin recommended group. Next slide, please. As we look at the U.S. adults who are recommended to be on a statin based on the 2018 cholesterol guideline, over half, approximately 24 million, are not taking one. As you can see, among the 17.8 million people with clinical ASCVD, about 40% are not taking a statin. Among the 4.6 million people with severe hypercholesterolemia, LDL greater than or equal to 190 milligrams per deciliter, about 90% are not on a statin. Among the 20.4 million people with diabetes, about 53% are not taking a statin. And among the 3.5 million people with greater than 20% 10-year ASCVD risk, about 65% are not taking a statin. That equates to approximately 24.2 million adults who are at increased risk of ASCVD events, which could be mitigated by taking a statin. These national data detailing the lack of statin use highlights many life-saving quality improvement opportunities. We encourage you to look at your performance and find opportunities for initiating conversations with your patients about the benefits of lowering their cardiovascular risk through statin use. Next slide, please. Thank you for watching the pre-work for the March 7th, 2024 Million Hearts Learning Lab. If you haven't already registered for the live session featuring Dr. Larry Sperling and Dr. Daniel Oren, you can do so at the link in the comments section. Dr. Sperling and Oren look forward to answering your questions and sharing insights into how they attend to their patients for whom statin therapy is indicated. We look forward to seeing you there.